Let's start by looking at the areas of the UK which are subject to extra restrictions, marked here in blue. By the end of the week, it's thought around 9 million people in the UK will be subject to extra controls. That's around 1 in 7 people. Now, it's all because of the rise in cases across the UK. We're in a much better place than we were back in mid-April, when cases were peaking at over 5,000 every day. But that figure is completely unreliable because we weren't doing much testing in the community. It was probably more like 100,000 new cases every day. Then cases fell until about mid-July and started to rise again. We're now seeing more than 3,000 cases every day, but that figure too is unreliable because many people can't get a test, so it could be much higher. It's thought that cases are doubling in the UK every 7 to 10 days, and what matters is the effect that will have on hospitals. If we look at England, in early April, up to 3,000 patients a day were being admitted to hospital with a confirmed COVID diagnosis. The numbers now are much smaller, though at their highest level for 2 months. We should expect patient numbers to rise as winter approaches. The key question, though, is by how much? Mortality has dropped substantially. Just 1 in 100 death certificates in England and Wales now mention COVID, the lowest level for 6 months. Now let's look at some European comparisons. Spain and France have both seen a big resurgence in coronavirus cases and an increase in hospitalizations, but nowhere near the level of the first peak. The UK government has warned the UK could be heading the same way unless people follow social distancing guidelines. Finally, an outlier, Sweden, never imposed a compulsory lockdown, and face masks are not recommended there in public places. Well, they had a much higher death rate than their Nordic neighbours in the first wave, but now their cases are staying low.